Good day once again. Dr. Yakubu is my name. Today we'll be talking about Candida infection, candidiasis for short. Now, what is candidiasis? Candidiasis, it's an infection usually affecting the genital tract, both male and female, that is caused by a fungal organism called Candida albicans. Now, this infection, for the most part, can also be sexually transmitted. But we need to say here that, particularly in women, Candida can also be present in the genital tract in certain amount as a normal commensal. It's not in all cases that Candida's presence in the genital tract in the vagina of a woman is considered infection. It can be there in the way that it is in a very healthy symbiotic relationship with the host. So it's only when the growth of these organisms become really very much beyond the normal that we say that the infection related to that candida has occurred, and particularly where symptoms begin to appear, then we say that yes, it is candidiasis, or that particular symptom may be due to candidiasis. When a woman contracts infection, now I'm saying a woman because I'll come to the way it also manifests. There are ways it manifests. By the way, I want to believe that this infection is also commonly called toilet infection among women, because once a woman uses a toilet or she goes somewhere, or once she gets an itch down there, most of the time they will tell you that they have contracted toilet infection. But actually, professionally, technically speaking, that infection is not actually gotten from the toilet. The possible relationship between vaginal candidiasis and toilet use is in the sense that when a woman uses a toilet and then especially passes feces, then she cleans herself from back towards the front, then she has a chance of transmitting or actually moving yeast or Candida albicans from from the anal area and smearing it to the vaginal area. That is the only relationship between toilet use and the infection we're trying to talk about, that is Candida. Otherwise, it is not by just merely sitting in the toilet bowl or whatever that you get that infection. It's more often from personal habits, including the sexual behavior. Now, when a woman contracts this, what are the symptoms? Usually it comes with very itchy genital tract. Sometimes there may be rashes outside, especially. Sometimes there will be a discharge, and that discharge is usually very thick and whitish. Sometimes it's off-white, and it has a characteristic odor, but in most cases it can even be odorless a bit. But if you have a thick whitish vaginal discharge, which sometimes comes in a cheesy form, associated with a lot of itching, then in most cases it is caused by, in fact, it's a very common infection. It's one of those things that can cause, is the commonest form of genital tract infection we see in women. Sometimes it may come with some pepperish sensation when a woman is urinating, especially when it is really very bad. Now, what are the things that can increase your chance as a woman having vaginal candidiasis? If you are in the habit of, as I said before, when you clean yourself following passage of stool in the toilet from back to the front, then you risk transmitting or packing organisms from the anal area, because Candida is present in fecal matter, in the gut, in the intestine. So each time we pass some kind of amount of Candida in stool, and so once you clean from back to the front, you're smearing Candida albicans towards the front, and you can get infection. Sometimes the spores of these organisms are also in wet towels, underpants, and all of that. So if you use and dry your toilet in dampy areas, sometimes the infection can still reoccur anytime you use the towels, because the spores can be still present in your towels, and then you smear them there, and then you have a recurrence infection. Of course, we mentioned sexual transmission before. If your partner has Candida on him, okay, incidentally, most men who have it, who carry it on their skins, are not aware that they have Candida infection, and until it gets really, really very bad before it manifests in men. So most men who carry Candida on their skin are not aware, and so if they can keep transmitting it again and again to women. Now, in men, the way it manifests is also that sometimes it comes with itching and some rashes in the genital tract, and sometimes you just see some red patches on the male organ, and sometimes coming with some discharge. But in most men, it does not show any symptoms at all. It's more often easier to show in women. Now, one other condition that can make Candida show much more in women is when the woman's immune system becomes compromised for whatever reason. One of those conditions that can relatively compromise the woman's immune system is pregnancy. When some women are pregnant, they notice increased recurrence of vaginal candidiasis. So by and large, if you have vaginal itching associated with thick cheesy discharge, which is in most cases is white or off-white, then it's most likely candidiasis. You don't need a vaginal swab in this case, all right? If it is candidiasis or you suspect candidiasis, go to a hospital, see your doctors. They know what medications they will give you. Please, in this case, don't use antibiotics to treat candidiasis. Antibiotics are not necessary for candidiasis. In most cases, it's only antifungal agents you need. When you use antibiotics in treating candidiasis, most times it gets worse, because what you do, you actually completely eliminate the bacteria that is in competitive inhibition with the Candida in the vaginal tract. You clear the bacteria and allow the fungus to grow more and get worse. That's the reason we see a lot of women coming down with recurrence. They will tell you they've taken antibiotics for this discharge, and yet it's not going, because you're treating it wrongly. So please, let's take note of this fact that if it is Candida or candidiasis in the vagina, you don't need antibiotics. All that you need to treat them in most cases is just antifungal agent. And it's also necessary that if you have a partner that you think needs to be treated, let him be treated as well, so that you prevent recycling the organisms. Thank you.